Hello, welcome to Portage County Matters. I'm Patty Dreier, Portage County Executive. This is a special edition of Portage County Matters, dealing only with the Portage County Healthcare Center and some of the choices that are before us as we wrestle with current issues and trends and some opportunities as well for our future here. The goal of this presentation, this show, is to tell the story of the Portage County Healthcare Center and its relationship to Portage County government. Not everybody is aware of the connections. To articulate the background, the changes, the challenges, and the opportunities for our future, and to guide more informed decision making. I wanted to provide some facts and some background that I think is really important for the people of Portage County to understand. And I'm not stating what decision I believe is the right decision. It's just the fact that we need to make sure that more people are informed and can help guide the best decision for our long-term future. The idea of health care, the care that's provided at the Portage County Healthcare Center, is vastly changed today from the system that once was, even a few years ago. And it continues to change very, very quickly every single day. Just if you watch the national news, I think you understand what I'm saying. The Portage County Healthcare Center facilities and services. So, the Healthcare Center is located at 825 Whiting Avenue. It's located on 7.5 acres and it's owned and operated by the Portage County government since the 1930s. There are 100 licensed beds by the state of Wisconsin at that facility. It's a one-story facility that was built in 1932, in 1966, and 1985, and 1994. There were additions or other constructions going on at that location. The boilers are 65 plus years old. The Portage County Healthcare Center is supported by 90 full-time equivalents on site. These are nurses or CNAs or dietary staff working in the kitchen or social work staff, administrative staff, and so on, with additional support staff from other county departments such as finance, human resources, facilities, and information technology. Based on recent comparisons, Portage County provides a better benefits package than the industry average, but this helps us with retention at this time. The average daily population using the healthcare center, that means the numbers of people who are using beds at the center, out of the 100 beds, it's about 70 people. Though we have that 100 licensed beds, we can't even fit them on the floor because we've created some private rooms compared to what had once been in the facility. The bed taxes we pay to the state of Wisconsin are $17,000 per month, or $170 per bed per month, whether or not we use it. What is skilled nursing care? It must be provided under the direction, it's health care that must be provided under the direction of a registered nurse to be safe and effective. At the healthcare center, there are 3 wings. So I want you to visualize this with long hallways if you haven't been in the facility yet. It includes 1 for short-term rehabilitation and 2 other wings that are for longer-term care. Timber Trail is a long-term care unit that's mostly semi-private rooms, that is shared rooms with shared bathrooms. Hillside Meadows is a long-term care unit with a focus on residents with memory care needs. Most rooms are also semi-private with shared bathrooms. We do not have a formal memory care program that meets state requirements at this time. Sunrise Garden is a short-term rehabilitation unit with 25 rooms. Most are private, but they share bathrooms. Again, this show is about the Portage County Healthcare Center. And the reason that I'm providing this background information as county executive in Portage County is that we need more people to have more background information and understanding about the complexities of the current situation and the challenges and opportunities before us so that we can guide better longer-term decisions. Senior living and preferences is part of the background I wanted to share. The continuum of care model is an integrated model for providing care where people move from the least restrictive to the most restrictive environments based on their daily living cares and needs. For example, if you live in independent living, you might move then to assisted living as you need more cares, and then on to skilled nursing or memory care. The continuum of care model provides a pipeline when it exists, prepares a pipeline for a skilled nursing facility. It helps to move people through and call upon the business of the skilled nursing facility when it's appropriate. And it also then provides a more sustainable financial situation for the skilled nursing facility rather than a standalone facility. Being in a skilled nursing facility requires a qualifying medical condition. It's not a residence for seniors or people with disabilities based on income. Most seniors and adults with disabilities want to live in their own homes for as long as they can and on their own in that home. So this is the movement upon us right now. Most seniors and adults with disabilities want to age in place in their own homes for as long as they can. About long-term care trends and healthcare trends, integrated clinical networks and integrated electronic medical records are the name of the game. That means that organizations that are in this business need to partner with other medical establishments very, very closely. We must be able to demonstrate medical outcomes, sort of as an extension from a hospital or a surgical situation in designated medical areas of care. So those 5 areas of care are heart failure. How are we demonstrating medical outcomes for heart failure patients, for heart attack, for pneumonia, for chronic obstructive pulmonary disease or COPD, for elective hip and knee replacements, and for coronary artery bypass graft. Skilled nursing is the most regulated industry, second only to nuclear power plants. Some people are surprised to know that a hospital has fewer regulations than a skilled nursing facility has to deal with. And it's becoming more complicated every day. We've just had a recent new kind of inspection only within the last month and a half at the Portage County Healthcare Center. And so it challenges us, as sometimes the inspections last for 3 or more days. The healthcare system of today, as I mentioned at the top of the show, is very, very different from the way it used to be when the Portage County Healthcare Center was created, and then even only a few years ago. There's a state and national movement away from skilled nursing facility beds, opting for less costly care, which makes sense, right? We wouldn't want to spend more money to care for people than is absolutely necessary. So home care, where assistance comes to the home and serves the person living there, is the least expensive, followed then by assisted living and then skilled nursing. Data shows that home care episodes, that's each situation when someone comes in to care for someone in their home, is sharply up, with a 72% increase in a relatively short period of time from 2001 to 2014. Assisted living facilities in Wisconsin has increased from 30,411 units in 2003 to 56,484 in June of 2016. Skilled nursing occupancy, that's the usage of the beds, the licensed beds, is continuing a downward trend. In Wisconsin, skilled nursing facility bed capacity has declined from 43,052 beds in 2003 to 33,910 beds as of June of 2016. There are 9 nursing homes within 35 miles of Stevens Point with a licensed bed capacity of about 1,500 beds. More long-term care trends. The health and some details about the Portage County Healthcare Center. The average cost for any person in a bed at the Portage County Healthcare Center is $309 per day, including therapies, radiology, labs, bedside care. Medicaid does not cover these costs completely. It's significantly lower than the average cost of care. So we lose money as Portage County operating the center. We lose money to serve those on Medicaid. Wisconsin's Medicaid nursing home payments are the worst in the country when comparing payment rates to allowed Medicaid costs incurred by nursing facilities. And this is according to a national study in April 2016 by LJ/HCC. Wisconsin nursing facilities experienced then almost a $350 million Medicaid deficit in 2015 to 2016. Again, Wisconsin's worst in the country for this. They're holding the money at the state level and not reimbursing nursing homes at the local level to the maximum capacity. The average loss is nearly $60 per day per Medicaid resident. Medicare, covering shorter acute stays, does a better job of covering costs, and private pay does still better. In fact, they're helping to subsidize the poor reimbursement of Medicaid. They're paying on average nearly $100 a day higher than the Medicaid rate. Again, essentially filling the gap that's left by Medicaid, or partially so, I should say. The law requires us, Portage County, to serve everyone regardless of the pay source, because we, Portage County, signed agreements to accept Medicaid and Medicare and other private insurances. So there's a misunderstanding that people can be turned away because of their inability to pay, and that's not true. We must accept everyone regardless of their ability to pay because of our acceptance of reimbursements from Medicaid and Medicare and other private insurances. Portage County Healthcare Center has a better payer mix than the average nursing home. Now let's transition to a little bit about our workforce in healthcare. 1 in 7 direct caregiver positions in Wisconsin's nursing and assisted living facilities are currently vacant as of a March 6, 2017 report from Leading Age Wisconsin and the Wisconsin Healthcare Association. Portage County government in the budget context is an important element for people to understand when it comes to understanding the full picture related to the healthcare center that we have at 825 on Whiting Avenue. Portage County Healthcare Center is an enterprise, so by definition it establishes a separate accounting and financial reporting mechanism for municipal services for which a fee is charged in exchange for goods or services. Revenues and expenses for the service are segregated into a fund called an enterprise fund, with financial statements separate from all other Portage County governmental activities. We also have an enterprise fund in our solid waste department, which takes no tax dollars to run it. And we have an enterprise at our highway department, which also operates without tax dollars in its operation. The tax levy for Portage County, that is the tax dollars that you pay, have been filling a funding hole for nearly 2 decades at the Portage County Healthcare Center. So I have a picture of it, and I know I've showed this on the screen of the Portage County Matters show in the past, but I think the picture is just so important and so clear for us to see that things have changed in the context of our healthcare environment. In the year 2000, the Portage County Healthcare Center was operating nearly a break-even scenario as an enterprise, so that it was not needing extra tax dollars to fill the funding hole created. But over time, things began to change. And in fact, right now, if we continue the trend where we are today, the Portage County Healthcare Center will require about $700,000 to $800,000 of county tax dollars to fill the budget hole in 2017. Recent expert consultants have told us that we cannot expect to have a financially sustainable model at the healthcare center with no outside source of funding, such as extra tax dollars that fill the hole. And it's not likely that this hole will stay just the size it is today. We have some major financial challenges upon us and ahead of us. The Portage County Healthcare Center is one of 30 different county departments, and your county tax dollars are spread across different programs and services provided by or supported through those 30 departments, except, of course, for the other two enterprise funds. So the Portage County government and budget context that I want people to understand is that the healthcare center is not a mandated service that must be provided through a county government service. Of course, we're aware of the private sector and nonprofit organizations as well as for-profit organizations that provide long-term care services, not just governmental organizations. Portage County has other non-mandated services too, though, like the county parks. We're not mandated to have county parks, or like a county-run library system. Many quality of life initiatives and programs and services are tied to the choices that our community has made over time to provide non-mandated services. On the other hand, Portage County has many mandated or legally required services that it provides by law. Of course, there's always different ways to deliver those services, but the bottom line is that we're required to have child protective and adult protective services, for example, as well as other social services. We're required to have a corrections program. We're required to have general government services, like the functions of assisting with helping us do the voting in our county or collecting taxes, for example. In Wisconsin, since 2005, we've had a cap on our levy. That's a limit of what we can add to our county budget in any given year. Under current law, we can increase our tax dollars today by, when I develop the county budget, by 0%, in other words, keep it the same this year as last year, or by net new growth. That's the amount that our tax base has grown in our county. Over the last few years, that's been 1% or less, even as utilities costs and other costs have continued to increase over time. So you can imagine, just like it would in your own checkbook at home, that this has squeezed and stretched the dollars and has forced choices to be made. And some of the issues of caring for our road systems in our counties and towns and villages are a result of this kind of levy cap, where there just isn't enough money to go around. And so we aren't able to fix them when we would like to be able to fix them. So there are more choices ahead of us as we continue to feel that crunch and have increased mandates and burdens passed off from the state level to us at the local level, and yet we don't have more resources that usually come along with those increased burdens. So we have a lot of challenges. But let's get back to challenges in the healthcare environment as well. There are regulatory trends in healthcare that are showing us that changes are happening quickly, and you have to be nimble to stay up with it all. We don't have the modern neighborhood design that many people seek in long-term or rehabilitative acute healthcare kinds of situations that we offer in skilled nursing care. We're lacking then the efficiency in a physical facility design because we have long hallways, so it takes a lot more steps to get from room to room, from door to door, to the dining areas, and so on it goes. And Portage County Healthcare Center will need an outside or county source of subsidizing its daily operation if we're going to stay in business. We will need to make choices about what we will give up in order to live within that levy cap. So it's a trade-off. You have to decide, what do you want more? Would you like to run a nursing home with 70 beds, say, used on a daily basis? Or would you like to take the same dollars and apply them to other programs and services offered throughout our county? And if we didn't provide the service, well, who else can? There are others in other sectors that do provide these services, when again by law Portage County has some requirements to provide other mandated services. Nevertheless, this might be a choice that our county makes, but the decision lies before us about a long-term answer for our future. I will tell you that one of our recent consultants that is a healthcare expert had shared with us a quote that I thought was pretty powerful that kind of sums up some of the things that I've spoken about thus far in this presentation to you through Portage County Matters about our Portage County Healthcare Center. He said, quote, "With continued pressure of lower reimbursement, increased regulations, workforce shortages, higher costs, and home/community-based services, there is a trend of declining numbers of skilled nursing providers and beds, especially government and non-for-profit organizations." Let's get to some opportunities and options and considerations. Portage County has had numerous studies and strategic plans completed for and about the Portage County Healthcare Center. I've got a stack of just a few of them beside my chair here on the show. In 2002, the most recent strategic plan recommended building a new facility at that time. Still no action to date, 15 years later though. We stand at this crossroads in part due to that inaction in 2002. Facility investments are absolutely critical. We can stand alone in those facility investments, or we can partner. We can build new, we can renovate, we could partner to build, we could sell our beds or partner on our beds in another facility or with another care organization. There are lots of choices. We could be part of standing alone, in county government, or we could be part of a continuing care community. If we continue operating the Portage County Healthcare Center, we will need to either ask taxpayers to exceed our levy limits by going to a referendum and paying more every year for us to fill the hole, or we'll have to give up other things in our county services in order to serve the people through the nursing home. And in all of this, I'm not saying that it's not important to serve people who need skilled nursing care. We just have to make some choices for the longer run and do what we believe is best. A new facility will cost $25 million or more. County taxpayers could borrow for that and pay for that. And then hopefully the Portage County Healthcare Center could pay it back someday. The Portage County Healthcare Center is still paying off debt that it had taken out in the 90s that was refinanced in the early 2000s for its last construction. The renovation, we could renovate. We could renovate for roughly $20 million or more. These are previous estimates that would need to be updated. But we would have to reduce the use of our beds during this kind of construction, and that would further compromise our ability to generate revenues to be able to make ends meet in as much as we're able to, even with a budget hole that we have every year these years. So do we want to go out to referendum and exceed our county levy and subsidize it or not? And how comfortable would the people of Portage County be willing to do this? So where do we go from here? We've had much discussion, much exploration. Do we want to stay in the business? Do we want to get rid of the business? Do we want to renovate? Do we want to build new? Do we want to partner with someone? Do we want to sell? Do we want to sell just the beds? Do we want to sell a facility and the beds? How do we retain our beds in Portage County for our future? Many of us are concerned about that. And we can't forget the economic impacts, the accessibility to citizens that don't have to, the accessibility to the beds. So citizens, especially somebody trying to come and visit their spouse at the center, wouldn't need to travel very far. But as I mentioned, within 25 miles or 35 miles of Stevens Point, there are around 1,000 other skilled nursing home beds available that are many of them are in modern facilities compared to ours. So as our consultant said, we can't wait very long or we will entirely lose any chance at competing in a market that is a market that's demanding efficiencies, demanding modern facilities, demanding the quality of care it deserves, those outcomes, that integration with our healthcare system, and all the modern amenities that go with the electronic medical records and so on. These are tough choices. I realize that. I wanted to offer you some background information in hopes that you, as a citizen of Portage County, can assist us in making the right decision, the right choice for our future. I will tell you, as much as anybody knows me in the community, you would know that I care deeply about our seniors and people with disabilities. You would know that having strong senior programs and services is really an important aspect of the budgets I've put together and what I believe that the people value in this county. So I'm not saying that we would want to do the wrong thing for anyone at all in this mix, except that we have choices that must be made, and we have to decide what do we want county government to do for the people, and what do we want to ask of the taxpayers of our county in helping us make our way forward, not just for this coming budget, but for many budgets to come, as the resources aren't getting any easier to come by for any of us. So thank you for that. If you have questions, if you have ideas, we hope that you will share them and that you will help us guide the wisest future possible for the Portage County Healthcare Center and what to do with our 100 licensed beds in our county. Thank you, everyone.